Hey, so let's going to talk about neonatal hydrocolpos. My name is Henry Santiago Larza. I'm studying from the Universidad Católica Santiago de Guayaquil. This is a presentation made for my medical English class with my Dr. John Moscoso. So to start with this subject, about neonatal hydrocolpos, we're going to say the definition about this. So this is a distension of the vagina caused by accumulation of any fluid due to congenital vaginal obstruction. The obstruction is often caused by an unperforated hymen or less commonly a transverse vagina septum.
Hydrocolpos is the distension of the vagina caused by accumulation of fluid due to congenital vaginal obstruction. The obstruction is often caused by an imperforate hymen, or less commonly a transverse vaginal septum. The fluid consists of cervical and endometrial mucus, or in rare instances urine accumulated through a vesicovaginal fistula proximal to the obstruction. In some cases, it is associated with Bardet-Biedl syndrome. If it occurs in prepubertal girls, it may show up as abdominal swelling. It may be detected by using ultrasound. It may also present at birth as a distended lower abdomen and vagina. It also associated with vaginal atresia.
So being clear about the definition, let's keep with this and let's see an ultrasound study for diagnosis of this sickness.
Dear viewers, I hope you are all fine. This ultrasound video shows a case of hematocolpos. This is urinary bladder, and now you can see a large hematocolpos, menstrual blood seen in the cervix and vagina. This is uterus, and this one is hematocolpos. Cervix is dilated along with vagina.
So that's a colpos, but with
due to the presence of
full of blood instead of
fluid
just fluids like
in its interior.
hormone or gland
Now
fluids.
you can see the cervix and uterus, the cervix and vagina.
So as you can see, an advantage of this situation is the diagnosis is like kind of easy. So this in medicine, the most important factor in treatment is the anomalies establishment of a correct preoperative diagnosis, how I said. So when the correct diagnosis is made, most of the patients will be cured with a relatively simple transperineal drainage procedure. And with the prognosis after diagnosis is that long-term follow-up is essential since the distended hypertrophic vagina and the associated hydronephrosis tend to develop intercurrent infection during their slow return to normal. So this will be the prognostic of treatment of the treatment of this syndrome.
Dear viewers, I hope you are all fine. This ultrasound video shows a case of
So as I said before,
this is usually due to
in this ultrasound,
imperforation
You can see the
uterus, and this one
distended
is
vagina,
hydrocolpos.
and inside of it will be fluids. In this case, it will be blood. Just to be sure of that. And here you can see the drain of fluids from the hydrocolpos.
You can see how much was inside. You can see what she has been carrying all this while.
So as you can see, there's a lot of fluid drained from there. So starting with the pros, one is it may be detected using an ultrasound. Imaging studying leads to early detection and treatment of these cases. And this is the good thing about this. When you make the diagnosis, the case is detected, you can start with the procedure like we saw before, starting draining the fluid out. And after that, we have to keep in touch with the patient to see if there is an infection produced after the procedure. Here is another video of ultrasound for diagnosis. As you can see, the bladder and the uterus. And the vagina with the fluid inside of it, so you can see the size of the vagina, which is not normally as it usually is in a sagittal cut. I mean, this is so useful when you have to make diagnosis to detect these cases and not think it's another thing, it's another cause, and make a wrong diagnosis. So the cons of this case that it may also present at birth as a distended lower abdomen and vagina, and it's also associated with vaginal atresia. And it's often being presented in kids, in neonatal kids, and in pre-puberty girls. This is the most common cases. But after that, this is a very rare condition. So, in our country, the MSP have not reported any case of neonatal hydrocolpos in Ecuador yet. So there was no case found after the research, though. So for concluding this, the imperformant hymen is the most common obstructive pathology of the female genital tract, so it should be considered as a differential diagnosis in all cases of abdominal mass in vagina in newborn. However, in the neonatal hydrocolpos is a rare condition, as I said, and it shows in this low rate of prevalence. So thank you. That's all.